In the spring of 2016, a 21-year-old college student named Wei Zexi lay dying in a Beijing hospital bed, his body ravaged by a rare form of cancer called synovial sarcoma. But Wei wasn't just another tragic victim of disease. He was the unwitting casualty of one of the most insidious corporate fraud schemes in modern Chinese history, orchestrated by Baidu, the company often called China's Google. For years, Baidu had been operating what amounted to a sophisticated medical advertisement fraud operation, selling search result placements to unregulated medical facilities and allowing them to masquerade as legitimate treatment centers. These fake clinics preyed on desperate patients like Wei, offering miracle cures and experimental treatments that existed nowhere outside their marketing materials. Wei's death would ultimately expose how China's most powerful internet company had built a business model that literally profited from human desperation and medical misinformation. Baidu's rise to dominance in China's internet landscape began in the early 2000s, when founders Robin Li and Eric Xu positioned their search engine as a local alternative to Google. By 2016, Baidu controlled over 80% of China's search market, processing more than 6 billion search queries daily and generating annual revenues exceeding 66 billion yuan, roughly $10 billion. The company's advertising model closely mimicked Google's AdWords system, allowing businesses to bid on keywords and secure prominent placement in search results. However, unlike Google's relatively strict medical advertising policies, Baidu operated with virtually no oversight or verification of medical claims. The company's sales representatives actively courted private medical facilities, many of them unlicensed or operating with dubious credentials, promising them top search rankings for lucrative medical keywords. Internal documents later revealed that Baidu's medical advertising division generated approximately 20 billion yuan annually, representing nearly one-third of the company's total revenue. This meant that roughly every third yuan Baidu earned came from selling hope to sick people, regardless of whether that hope was real or fabricated. The mechanics of Baidu's medical fraud operation were both simple and devastating in their effectiveness. When desperate patients or their families searched for terms like cancer treatment, tumor therapy, or specific disease names, Baidu's algorithm would prioritize paid advertisements over legitimate medical information. These ads were deliberately designed to appear as natural search results, with minimal visual distinction between paid promotional content and organic medical information. The highest bidders, typically private medical facilities willing to pay premium rates for patient referrals, would dominate the top search positions. Baidu's keyword auction system created perverse incentives where the most aggressive and well-funded medical fraudsters could effectively monopolize search results for critical health information. The company charged these medical facilities anywhere from 50 to 999 yuan per click, meaning that each desperate patient who clicked on a fraudulent medical advertisement generated substantial revenue for Baidu. Sales representatives were incentivized through commission structures that rewarded volume over verification, leading to a corporate culture where medical advertising clients were actively recruited regardless of their legitimacy or treatment efficacy. Wei Zexi's tragic journey through Baidu's medical fraud ecosystem began when his family searched online for experimental treatments after traditional therapies failed to stop his synovial sarcoma. Baidu's search results prominently featured advertisements for the Beijing Armed Police Corps Hospital No. 2, which claimed to offer cutting-edge immunotherapy treatments developed in collaboration with Stanford University. The hospital's advertisements, purchased through Baidu's bidding system, promised revolutionary DCCIK immune cell therapy that could effectively treat various cancers with minimal side effects. Wei's family, desperate for any hope of survival, traveled to Beijing and paid approximately 200,000 yuan for the experimental treatment, depleting their life savings and borrowing heavily from relatives. The reality they discovered was far removed from the promises made in Baidu's sponsored search results. The hospital's immunotherapy program was largely fabricated, consisting of basic procedures with no proven efficacy against synovial sarcoma. The claimed Stanford University collaboration was entirely fictional, and the medical facility itself operated more as a patient recruitment center than a legitimate cancer treatment hospital. After months of ineffective and potentially harmful treatments, Wei's condition deteriorated rapidly, and he died in April 2016, becoming the human face of Baidu's systematic medical fraud. The scope of Baidu's medical advertising fraud extended far beyond individual cases like Wei Zexi's tragedy. Investigative journalists and regulatory officials discovered that Baidu had entered into advertising partnerships with over 12,000 private medical facilities across China, many of them operating without proper licenses or medical credentials. These partnerships generated an estimated 200 million patient referrals annually, creating a massive pipeline of vulnerable individuals seeking medical treatment from unverified providers. Baidu's advertising platform had become the primary marketing channel for China's underground medical industry, including facilities specializing in everything from cancer treatments and fertility procedures to psychiatric interventions and surgical operations. The company's keyword bidding system had effectively created a marketplace where medical misinformation could be purchased and distributed at scale, with patient desperation translating directly into corporate profits. Internal Baidu documents revealed that the company maintained separate advertising policies for medical keywords, allowing claims and promises that would have been prohibited in other advertising categories. Sales teams were specifically trained to work with medical facilities that had been rejected by traditional advertising channels, positioning Baidu as a platform willing to accept clients that other companies considered too risky or potentially fraudulent. Following Wei Zexi's death and the subsequent media coverage, Chinese regulators launched comprehensive investigations into Baidu's medical advertising practices that revealed systematic violations of advertising law and consumer protection regulations. The Cyberspace Administration of China discovered that Baidu had failed to implement any meaningful verification procedures for medical advertisers, allowing unlicensed facilities to purchase advertising space alongside legitimate medical institutions. Investigators found that Baidu's sales representatives had actively encouraged medical facilities to make exaggerated treatment claims, providing guidance on how to craft advertisements that would generate maximum patient interest regardless of medical accuracy. The company had also failed to clearly distinguish between paid advertisements and organic search results, deliberately misleading users about the commercial nature of medical information they encountered. Regulatory audits revealed that approximately 40% of Baidu's top medical search results were paid advertisements, often pushing legitimate medical information and established hospitals to secondary positions in favor of higher-paying private facilities. Perhaps most damaging, investigators discovered internal communications showing that Baidu executives were aware of complaints regarding fraudulent medical advertisers, but chose to maintain these profitable partnerships rather than implement stricter verification procedures. The financial architecture underlying Baidu's medical fraud operation demonstrated how the company had systematically monetized human suffering through sophisticated advertising technology. Baidu's medical advertising clients typically paid between 30 to 85% of their marketing budgets directly to the search engine company, creating dependency relationships where fraudulent medical facilities became some of Baidu's most valuable customers. The company's algorithm was specifically calibrated to maximize revenue per search query, meaning that medical keywords associated with serious diseases like cancer, diabetes, and heart conditions commanded premium pricing that incentivized aggressive bidding wars between medical facilities. Baidu's sales teams employed sophisticated targeting techniques, analyzing search patterns to identify users demonstrating signs of medical desperation, then ensuring these vulnerable individuals encountered advertisements for high-margin medical services. The company's financial reports showed that medical advertising generated gross margins exceeding 75%, making it one of Baidu's most profitable business segments despite requiring minimal operational investment beyond basic advertising infrastructure. This revenue model created powerful institutional incentives to maintain fraudulent medical partnerships, as eliminating questionable advertisers would have directly impacted Baidu's financial performance and shareholder returns. The regulatory response to Baidu's medical advertising fraud reflected the Chinese government's recognition that the company's practices threatened both public health and social stability. In May 2016, the State Internet Information Office imposed unprecedented restrictions on Baidu's medical advertising operations, limiting medical advertisements to no more than 30% of search results for health-related queries, and requiring clear visual distinction between paid content and organic information. Regulators mandated that Baidu implement comprehensive verification procedures for medical advertisers, including licensing checks, facility inspections, and treatment efficacy documentation before allowing any medical facility to purchase advertising space. The company was forced to establish a dedicated medical advertising review department staffed with qualified medical professionals capable of evaluating treatment claims and identifying potentially fraudulent medical services. Baidu received formal administrative penalties totaling 3.26 million yuan and was required to refund approximately 2.5 billion yuan in medical advertising fees to facilities that could not meet new verification standards. The regulatory intervention also included ongoing monitoring requirements, with government inspectors granted unlimited access to Baidu's advertising algorithms, sales practices, and client verification procedures to ensure compliance with new medical advertising restrictions. Beyond regulatory penalties, Baidu faced massive civil litigation from families affected by medical advertising fraud, with Wei Zexi's family leading a class-action lawsuit representing over 1,800 patients who had been directed to fraudulent medical facilities through Baidu's search platform. The litigation revealed additional evidence of systematic fraud, including internal company emails discussing strategies to maximize revenue from desperate patients and sales training materials that explicitly encouraged representatives to avoid verifying medical advertiser credentials. Baidu's stock price declined by approximately 15% in the months following the scandal, representing a market capitalization loss of roughly $8 billion, as investors recognized the regulatory and reputational risks associated with the company's medical advertising business model. The company's international expansion plans were significantly impacted, with potential partners in Southeast Asia and Europe citing the medical fraud scandal as a factor in their decisions to work with alternative search engine providers. Perhaps most significantly, the Wei Zexi case became a catalyst for broader healthcare reform in China, leading to increased regulation of private medical facilities and stricter oversight of medical advertising across all media platforms. The scandal fundamentally altered public perception of Baidu, transforming the company from a celebrated technology innovator into a cautionary tale about corporate responsibility and the dangers of prioritizing profit over human welfare in healthcare-related services. The Wei Zexi scandal ultimately exposed how Baidu had constructed a business model that systematically exploited human vulnerability for corporate profit, turning medical desperation into advertising revenue while abandoning any pretense of social responsibility or ethical business practices. The company's medical advertising fraud represented more than isolated corporate misconduct. It revealed a fundamental corruption of information systems that millions of Chinese citizens depended upon for critical health decisions. Baidu's willingness to prioritize fraudulent medical advertisers over legitimate medical information created a digital environment where seeking help for serious illness often led patients toward exploitation rather than healing. The scale and sophistication of this fraud operation, generating billions in revenue over multiple years while company executives remained aware of its harmful effects, demonstrated a level of corporate cynicism that transcended typical white-collar crime. In the end, Baidu's medical advertising scandal serves as a stark reminder that in the digital age, the power to control information carries profound moral obligations, and the consequences of abandoning those obligations can be measured not just in financial terms, but in human lives lost to preventable deception and corporate greed.